about BMI. Was any? Are you? I talked to you about BMI and how I didn't think that BMI was a great indicator of overall health, okay? And if you didn't get to catch that, I think it's on our YouTube channel. Not yet. But over the next couple weeks, I wanted to talk to you guys about like different health markers, because a lot of people are getting their blood drawn and getting blood panels, and it's just great to be educated about what you're seeing on those blood tests and blood draws and things like that. So today I want to talk to you guys about triglycerides, and what those are. They're basically just fats in our bodies. Yeah, fats in our cells primarily. And you should care about this because the higher the triglyceride number on your blood test, the more likely you are going to be insulin resistant. It's a direct correlation. All right, so basically when you eat any type of processed carbohydrate, and I kind of put this in order up here, but when you eat a processed carb that has either fructose, sucrose, or high fructose corn syrup, those are the 3 different types of sugars, your body produces insulin to help lower your blood sugar in your body, all right? So that's the great part about insulin. However, when you start to overconsume those carbohydrates and you're constantly bombarding your body with carbs, you have this spiked insulin level that is unable to come down because basically your receptors in your body get tired. I like to compare this to like a car engine. If you constantly go 0 to 100 and you don't go anywhere in between with your car, and then you brake as fast as you can, how long do you think your car engine is going to be good for? Very little amount of time, right? 0 to 100, 0 to 100, 0 to 100, and you're going like, not even a mile from this stop sign to this stop sign, 0 to 100. Your engine's going to blow. It's the same exact thing with your body. When you're constantly overloading your body with processed carbohydrates, which is, in my mind, sugar, your insulin levels are constantly spiked and your receptors get thrown off. Well, there's nowhere for that sugar to go in your body because the insulin can't bring it down anymore. So that's when fat starts accumulating around your cells and your organs, and then you could become insulin resistant, okay? That's a super quick, very non-scientific way of how you get type 2 diabetes. The crazy part is when you get type 2 diabetes, since all your receptors in your body are off, there's a hormone called leptin in your body, and it suppresses appetite. Leptin levels are super high when you sleep in healthy individuals, and they're really low when you're not sleeping. This is a great example of why you don't wake up when you're sleeping every 2 hours to eat, but you typically eat every 2 to 3 hours during the day, okay? Your leptin levels are at an all-time high during sleep, super low when you're not sleeping. However, leptin, those receptors in your body, leptin, it basically blocks that hormone. And so your brain just constantly thinks you're hungry, even though you're not, okay? So you can see how that downhill spiral of many, many chronic diseases happen. I've talked about this so many times. I talked about it probably 2 months ago and then 4 months ago about leptin and how sugar affects our body. But it's the same exact thing. So when sugar stays in your bloodstream, you're going to be injecting insulin now to live, all right? When we think of triglycerides, basically what we want to see is a low triglyceride number, and then there's a HDL, which is like the good cholesterol in your body. We want to see a high HDL ratio. So you'll see both of those different HDL and triglycerides on your blood test. The lower your triglyceride number, the better, right? Fats in our blood, you don't want that many fats in your blood. But the ratio of those two numbers are actually more important. So I kind of put, like, if there's an individual that had 150 HDL and their triglycerides were 25, you look at that and you're like, oh, that's not terrible. Triglyceride number is low, right? Your HDL is high. That's pretty good. That's what we want to see. But the ratio of that is 6, right? If you have a little bit higher triglyceride number and a little bit lower HDL number, that ratio is only, what, 2.5, 2? And that's actually a better predictor of overall health than those two numbers alone. Does that make sense? Yes. So definitely pay attention to the ratio versus just the individual number. All right. And I kind of wrote up here that sick, well, fit chart that we talk about all the time. We're looking to keep that ratio around 1.5 or lower. If your triglyceride number is over that 150 mark, you'd be considered sick. Well is in that 100 category, and then fit is in that 50 category. Those numbers are great, but like I said, the better predictor of overall health is that ratio. And your doctor should be telling you that if they're going over blood tests with you, okay? They should be. And I would say many of them do, but that's something to ask them about as well, the ratio versus just the individual number, okay? When we eliminate processed sugar, we're gonna see all of our health markers improve, all right? But in order to really hone in on triglycerides and HDL, in order to decrease your triglycerides, increase your exercise intensity, you can decrease processed sugar and carbs and eat quality fats. The other way to decrease your triglycerides is to limit your alcohol. And it's no shocker, the same thing to increase your HDL is the same thing. You're gonna see that those three things, increasing your exercise intensity, limiting processed carbohydrates, and eating quality fats are going to help all of your health markers, not just these two things. Okay? Questions? Hopefully you're a little bit more educated on what triglycerides are, and I'll continue to kind of focus on HDL, LDL, all the things, so you guys can become more aware. If you are interested in getting a blood test, Magruder offers them first Thursday of the month. And like they don't take insurance or anything, it's just, what? Yeah. Yep. Yeah, for the blood test. But it's a really good, I mean, the price is really good, and you get your results back fairly quickly. I always recommend people do their blood test at least once a year. Twice a year is better. Yep. Because then you truly can tell. I mean, you can tell obviously in the gym if you're making progress, but the best way to see how your nutrition is affecting your body in the most accurate way is going to be your blood. So just something to think about. If you guys don't have any questions, have a great evening. Enjoy the sunshine.
Thank you.
Yeah, you're welcome.